starting and ending on time. Welcome to all of our attendees. We have several staff members here in front of you that we'll be introducing throughout this webinar. We have some special guests from one of our partner collaborators as well. We do have a slide deck that we are going to go through, so I would ask that we begin to share that so that we can get started. There we go. So tonight we are going to be talking on several topics. We hope to answer many of the questions that are out there in our community for both parents and staff. We are not going to take live questions tonight. What we've done is our PTA Council, which is a body that consists of all of the site PTAs that work together as a collaborative across the district with an overall council. They are a fabulous organization who does great work with us as a school district on behalf of parents. They have done an awesome job of collecting the questions and concerns from the community and provided those to staff. So we are going to go through those questions as best we can. We want to encourage you, if you do have questions when we are done at the end of our 90 minutes with you, please reach out to your site PTA. They very likely could have some of the answers, or your site administrator. They'll probably be able to answer many of your questions as well. So tonight for introductions, we are very pleased to have with us our continual contact at Seattle-King County Public Health. We've made a new friend in the public health realm. It's not something that school districts normally have that close partnership with, but we certainly do now with Sarah Regal, who is an administrator with our local county health. And we are pleased to have her here with us tonight to share some information regarding our work together in moving towards more students in in-person learning. Also here, we're really pleased to have Carla Rimmer, who is our IMS nurse, but is also taken on the role of being our COVID-19 health and safety officer. And I know Carla has many conversations with our local health department as well. We have two of our board members here with us tonight, Maggie Ty Tucker and Brian Janini Upton, and I might just throw it to them for their thoughts as we work through some of these topics. And throughout the night, you will see our school principals popping in. They're not all here yet, as well as our team leaders in our operations, our human resources department, and our learning services department. But as you can see on the slide, we do need to give a huge shout out and thank you to our Mercer Island School District PTA Council, and in particular, their president this year, Christy Seekhouse. She has worked with myself and our communications coordinator and our assistant soup Fred Rundle in really gathering these questions and working through all of the questions that we hope will answer your question. So for tonight's agenda, the topics we're going to be addressing are aligning our decision making. We know there's lots of questions about how are the decisions made as to who to bring back and when. We're going to give a health and safety update. We're going to talk about what's occurred with our operations and our facilities during this COVID-19 pandemic. And then we are going to focus on students. Students are the priority for us. And we're going to break it into two sections, one being about the first part of this year, September through December. So our current state of the schools for our students. And then we're going to talk about future and January and beyond. We are also going to spend some time talking about our partnership with the Mercer Island Education Association, who represents our employees, both our certificated, meaning our teachers, and our classified. which is all our other employees, such as our parapros and our bus drivers and our clerical support and custodians, as well as many more. And then lastly, we know that there's been some questions about the financial impact, so we're going to talk about that. And we'll then finish the evening by sending you off with what could be some potential future topics for other webinars. So moving forward with our decision making, and this is the slide that I know you've all seen many times. It has our values, vision, and mission statements on it. Our board over the past couple of years worked really diligently to align this with our community. And so I'm hopeful, I didn't prep them for this so they can graciously say no, but I'm hoping that one of our board directors might just quickly walk through the components of our values, vision, and mission.
I defer to Brian on this one since I wasn't here for the beginning of the development process.
Thanks so much, Director Tucker. The board took a year and a half along with the district administrative team to answer some important questions as to where we are now and what is the current culture of the Mercer Island School District. This was coming out of the Vision 2020, which was the guiding document that was with us for around a decade. And in that, we were able to fine tune our values down to supporting the whole child, creating inclusive and equitable learning settings, ensuring the school communities are safe and supportive, and providing rigorous and challenging learning. That comes into our vision of inspiring our students to be lifelong learners as they create their future. And then obviously the overarching mission is to foster learning by engaging students in thinking critically, solving problems creatively, and working collaboratively. All of this comes into the hashtag that students are the priority. And so where our former vision, mission, and values centered on 21st century thinking skills and learning and technology, we really shifted and pivoted the district to focus on students, focus on the whole child, the whole student, and them creating their future. And we're very fortunate that we were pivoting into this direction pre-COVID because it put us in a trajectory to be able to really care for our students and ensure that our resources, services, and supports went directly to those students who were furthest from educational justice and who were most vulnerable in need of our assistance.
Thank you, Brian. Sorry to put you on the spot like that, but great job. So next up, we're going to talk a little bit about who are the groups that we work with as a public school district. And we have a lot of partners and a lot of entities that we need to coordinate with, and especially in this time of COVID-19. So you can see at the center of this is our district. And we always are coordinating with the OSPI, which is the Office of Superintendent of Public Instruction, kind of equivalent to some states what they call their Department of Education. We also always are coordinating with our MIEA, our collective bargaining units, our families and PTA, and of course our board. During this pandemic, our partnerships have also been engaged with, frankly, the governor's office. You might remember back in March, it was the governor's office that made the initial closure for schools. Washington Department of Health, we have documents from them that we need to carefully consider the recommendations. We also have the Washington Department of Labor and Industry that weighs in for how we are going to be supporting our employees. And then our very close partner right now in Public Health, Seattle, King County as well. So all of these are our community partners that we consult with as we are making decisions for moving forward with in-person learning during the pandemic. This next slide is all of the different documents that we are utilizing and continue to utilize. Some of them are static, but some of them are ever evolving. And just as a reference, we are recording this webinar and it will be posted on our COVID-19 resources webpage. I think it's now titled Learning Forward. And all of these links will be live. So if you want to check out any of these documents, you will be able to see them and see the updated versions as these documents are continually updated. So what are some of the guidelines or the fence posts that we need to be really paying attention to during this COVID-19 pandemic? We need to, of course, be paying attention to what's the community spread. And when we work with our partners, of course, that's taken at the state level. We have guidance from the state, our region, which is for us frequently the East Side region. We have a lot of collaboration with districts in what's considered the East Side region. Also with our Puget Sound Educational District, which coordinates, I think, about 60 plus districts in the region. We also work with our county, clearly our county health, and then what's locally happening within community spread. Just a reminder, each state operates under different guidance when it comes to their education system. And in Washington, some of the guidance and the recommendations that we have been given can be very different than another state. And we do look to other states for how they are managing and pivoting during the COVID-19 pandemic, but we also have to follow the guidance that occurs within our state. The Washington State Department of Health Decision Tree is a major guidance document for us, and we're going to address that a little bit here with our health experts. And then one other component that we have always talked about during all of our presentations is the consideration of staff availability. When this crisis first hit, many of the surrounding districts made the decision to close prior to the governor's closure of schools because they did not have staff available to keep their schools open. And that continues to be a concern, that staff availability could hinder us being able to provide that in-person experience. Staff have leaves that are available to them, as well as we also have to consider if a staff becomes ill or needs to quarantine. That's a reality in this current health crisis. So let's talk a little bit about health and safety. And I'm going to now turn it over to our partners at King County Public Health first, I believe. And then Carla is going to jump in with what are some of the things we're doing here on Mercer Island. And Sarah Riegel from Public Health, I'm going to turn it to you and ask you to please introduce your colleague who's here with us as well.
Thank you. I appreciate the introduction. I'm glad to be here this evening. Also joined by my colleague Preeti Modipan. I think she'll just be listening, but available if there are some questions as well. It's really a pleasure to be here. I appreciate the introduction and the invitation to be speaking with your community. I am working now for Public Health, Seattle and King County, supporting the COVID-19 response on what we've created as the Schools and Childcare Task Force. And prior to the response, my role has always been to liaison with schools and education settings from early learning all the way through K-12. And since our outbreak began locally in February, a small team has convened and been dedicated to supporting schools and childcare through this pandemic. Along with public health staff, we've partnered and engaged directly with the Puget Sound Educational Service District, school leaders from across the county, educators, school staff, parents, and the community to address the specific needs in this sector. Public health has been here to provide up-to-date information, resources, and tools, along with training to schools to help in their decision-making and guide the implementation of in-person learning should they choose to do so. Over the last several months, I've had the great opportunity to work closely with many leaders here from Mercer Island, including Superintendent Donna Koloski, Assistant Superintendent Fred Rundle, and District Nurse Lead Carla Rimmer, who you'll hear from shortly. Your leaders are deeply committed to collaborating and working together towards in-person learning for your district. They face the most challenging decisions about how to operate their schools during this unprecedented time. As the parent of an elementary school age child myself, I know right now that we're all facing really incredible, difficult times and difficult decisions to be made for our families and for us as individuals. And while we keep our kids home and prioritize their health and safety right now, we know that there has been substantial learning loss for many children, and the risks exist for their social and emotional well-being while away from school. The Washington State Department of Health has created a decision tree for the provision of in-person learning for K-12 students during the pandemic, which Superintendent referenced just now. This is really a framework that was designed with input from our local health department, amongst others, and also at the request of local district leaders. We heard from lots of superintendents early on in the pandemic that they needed a framework and a guidebook to help them make these decisions about what to do. So the framework is based on a review of the science, frameworks from other states, and some experiences of school openings in other countries that resumed in-person learning earlier this year. It's really a tool that can be used to assist both local health officers and school administrators in deciding whether to resume in-person instruction. And while the Department of Health encourages local health officers and local health departments and school administrators to work together, just as we have here in Mercer Island, to choose the best settings for their students, ultimately school administrators are responsible to establish appropriate educational services. In King County, the local health officer will advise the school administrators on the community level of COVID-19 activity, the community's access to testing, and the health department's capacity to respond to cases or outbreaks in schools with time investigations and contact tracing. The decision to resume in-person learning is quite complex and requires weighing both the risks and the benefits to all. When choosing thresholds to resume in-person learning, the Department of Health considered both the health risks of COVID-19 to students, school staff, and the surrounding community, as well as the benefits of in-person school to children and their families. Though the rate of community transmission is currently high, the decision tree allows for the option of limited in-person learning in small groups of students for those with highest needs, such as students with disabilities, students living homeless, those farthest from educational justice, and our most young learners. Our youngest learners have shown the most challenge with remote learning and often need more supervision in their work and benefit greatly from teacher-led social emotional learning and face-to-face playtime along with their peers. Before introducing or inviting more students into buildings, Public Health has recommended that schools monitor key indicators of COVID-19 transmission, which we do daily, and look at those numbers for at least 2 weeks. Data for King County's key indicators are changed and updated daily. And we also recommend that schools look broadly at data for the whole of King County, recognizing that people move throughout the county regularly and not of all of a district staff or teachers live within this district perimeters. The rate of cases in our community is but one factor to consider. Schools must also consider their own ability to implement mitigation strategies and assess their facilities and staffing capacity. All has been done here in Mercer Island. In order to resume in-person services for students, schools must be able to implement strong and consistent mitigation measures to prevent transmission and have solid response protocols and staffing in place to respond quickly and effectively if cases arise. Mercer Island has demonstrated their ability to do these things. And where schools are able to demonstrate that, they can implement these measures, and public health supports the return to in-person learning for those students. Mercer Island's plan includes the opportunity for families to choose in-person or remote, and an opportunity to quickly pivot to synchronous remote learning should any one student or a cohort of students need to be quarantined at home. Carla will be telling you more about how the district plans to implement these mitigation strategies and measures to prevent transmission further. We know that the risk of spreading and catching COVID-19 can be lowered substantially in school settings when those health and safety guidances are followed consistently and correctly. And the risk is lower with every added mitigation effort. It's important that we do all of the things. If we're not taking efforts to slow the spread outside of schools, it will likely find its way into schools. And this underscores why mitigation measures are critical for families and staff to maintain both at school and away from it. There are many situations where COVID-19 can spread, but the ways to prevent it remain the same, whether you're at school, in an office building, at home, or elsewhere in our community. I'm here to just make a general reminder to everyone: continue to wash your hands frequently with soap and water. Stay at least 6 feet away from others outside your home. Always wear a cloth face covering or mask to cover your mouth and nose when you're outside your home. Avoid touching your eyes, nose, or mouth with unwashed hands. Stay away from others who may be sick, and absolutely stay home if you are sick or showing symptoms. Avoid poorly ventilated spaces. And for all of us, fewer, shorter, and safer interactions in our community are crucial. When we follow these recommendations correctly and consistently, wherever we are, we can greatly reduce the chance that we will get sick or pass COVID-19 to those around us. Importantly, too, we must consider what interactions are critical in our lives and prioritize those more important to us and to our community. Every day, each of us will need to make important decisions about how to keep ourselves, our loved ones, and our communities as safe as possible. I understand there were also some questions that came forward about the vaccine. So I want to address that. Currently, the State Department of Health is responsible for the primary plan of prioritization and distribution of the vaccine. So the local health jurisdiction will be responsible for implementing that plan locally in our communities. It's very much an emerging plan right now. There is a draft plan in place in the Department of Health that's available, which shows that the first phase of the vaccine is being prioritized for high-risk healthcare workers, first responders, and people with certain comorbid and underlying conditions that put them at significantly higher risk. Phase 1 also includes older adults living in congregate settings. Phase 2 does name K-12 teachers and school staff as well as childcare workers among other prioritized populations. The initial doses of vaccine that will be immediately available will not likely be enough to cover all of those individuals in phase 1. Therefore, the timeline for subsequent phases is still quite unclear, but will be communicated directly to schools and to the community as it is available. In addition, only the state will decide if the vaccine will be required in any setting, including school. If it were to be required, like other school-required vaccines for communicable disease that we already have, and if an outbreak were to occur, any non-vaccinated student or staff could be excluded from school for a period of time. Public Health will continue to work closely with the Mercer Island community to support your school leaders, students, and families. We encourage you to sign up for updates that you can receive directly from our blog at publichealthinsider.com or visit kingcounty.gov/COVID/schools to view our toolkit and frequently asked questions specific to COVID-19 and schools. Thank you again so much to the Mercer Island community for inviting me here and for all the work that you're putting into these difficult decisions moving forward for your families.
Hi, everyone. It's finally my turn. I'm Carla Rimmer, and I am the school nurse, as I mentioned, at IMS. And I guess I either drew the short straw or the long straw between Shelley and I when it came to becoming the COVID safety officer for the district. In fact, I think that was a new title I was just given this week. I just thought I was the person communicating with public health. I'm here to give you the updates about things that we are doing at the district level with staff and students that are currently in building. And as we have been planning to bring more students back into the building, to hope reassure you, we're doing everything we can to mitigate getting COVID in our schools. I am not an epidemiologist. I just play one on TV every now and again. And even with all the mitigation measures I'm going to talk about, I cannot guarantee that one of our students or one of our staff members haven't or won't get COVID. So I'll just kind of move through what we're doing. And as always, you're welcome to follow up with me with questions to my district email or the nurse in your building if you have other questions as well. So the first thing that we're going to ask all, and we are asking current staff and students that are coming into building as well as visitors, and that we will expect any future students to do on a daily basis, is to have a health attestation completed at home. And for those of you that may not be familiar with what a health attestation is, this is a list of questions that ask about COVID symptoms, and then also about your exposure to COVID-19 in the past 14 days, and or a diagnosis of COVID-19 in the past 10 days, or if you've been told by anyone to quarantine for the past 14 days. And the reason that we want everyone screening themselves at home every day is it's important for all of us to do a body check and say, do I feel well? Am I well enough to go to school? Because unlike previous times, we can no longer have school be a place where people come when they don't feel well. I've told several of my friends, if I have $100 for every time a student has come to my health room and told me their mom and dad gave them Tylenol that morning because they had a fever, I might not be working for the district anymore. We cannot have that happen. You have to be honest about what's going on with your family, what's going on with the health of you as a staff member, and we need to make sure that school is a well place for everybody, so that we can stay open. So thanks for doing the health attestations. Those can be accessed in Skyward. When you log into your student's account, it should be the first thing that you see when you come into Skyward. I have 2 students, so and I'm a staff member and I live on the island. So when I log in, I see my name, I see my kids' names, and I can fill those out. It's very quick. They auto default to no. So if you are feeling well, it takes probably less than 2 seconds to do. The third thing that we're doing is that we do require that all staff and students are wearing masks or face coverings while they're in the building. I went just to double check the updates because I know at one point there was a little bit of a longer list of people that may not be required to wear masks. That came out a long time ago by the CDC, but the list has actually really shortened. The only people that won't be wearing masks are those that are 2 years old and under, and we don't have any of those students in our buildings. People that have significant difficulty breathing. And one of the examples they give would be someone that's unconscious. So those people probably won't be at school. And then anybody with a disability that may have challenges wearing a mask, we'll be working with families to learn and think about other alternative measures that we can put in place to keep your students safe and to keep our staff safe. If I missed anything else, Sarah, that is on the list, remind me, but those were the kind of updated guidance that I'd seen. Additionally, we have worked with our staff and they've had training based on the labor and industry guidelines. So labor and industry provides the guidance to our district on how to keep our staff members safe. Prior to COVID, they didn't have any guidance for masks in schools, and they've come out with specific guidelines that determine, depending on the staff member's job role, the task that they do, and the length of time that they need to spend working with students, the type of mask that they wear is more than a cloth mask. So we provide training with our staff members. Some of our staff have been fit tested for N95 masks because the type of job that they're doing, labor and industry is requiring that we provide that for staff members. We've done a lot of training with staff, and we hope that you are doing this at home with your kids, but reminding people how to properly wash their hands. You cannot do that enough. When we were in peak flu season last year, and I, on an average day, might see 20 to 40 kids, I probably wash my hands 80 times a day or more, just in between the things I'm doing. So you cannot wash your hands enough as you're going about the day. We will continue to require social distancing. I think Fred, Donna, and I asked Sarah if at any point in the near future, the public health department will be decreasing the distance for us of 6 feet. And that is not something that's going to change in the short term. So that does put some limitations on the number of students that we can have in each classroom, but distancing does work. And I'm going to talk about a little bit more about that on my next slide, and you'll hear why that's working for us. We have ongoing health and safety training that's been happening for staff. We did it at the beginning of the school year, and then any staff that are increasing their frequency of being in building or working more in person with students, they are receiving updated and ongoing health and safety training. Staff has also been given guidance on increasing cleaning and disinfecting in the classrooms. We're doing a lot of high touch surface cleaning of doorknobs and desk surfaces. And then our custodial staff is doing an amazing job on a nightly basis on helping to keep our building clean as well. Our ventilation systems are filtering at the highest level that they can filter. I don't know if Tony's talking tonight and he can give more information about that, but we have updated our ventilation. We're encouraging staff to keep windows open, doorways open whenever possible to maximize airflow through spaces. And then additionally, we have set up the nursing team has been trained and is working with public health when needed on contact tracing. And I'm going to also talk about that a little bit more in the next slide. just before I move on, Donna in one of her previous slides mentioned to all of you that we do have a Mercer Island School District COVID safety plan that is available on the website. I think it's approximately 40 pages, and it does have everything you would need to know about COVID health and safety for Mercer Island. It's also a document that is auto updated. So anytime I go into it and change the frequently changing information, it's updated every 5 minutes. So whenever you access it, it should have the most up-to-date information available that we've placed there. So now I'm going to answer some questions that have come up from various parents that Christy collected. One was, what is the process for notifying the district if a student or staff member has tested positive for COVID-19? So right now we are wanting to know that from our staff and students that are in person. We're tracking what's happening in our buildings. And so we would hope that that's the notification measure would either be primarily through the health attestation, because if you think you have COVID-19 or have tested positive, you should be failing the attestation. And then the nurse assigned to your building will get a notification that the student or staff member has failed the attestation. An additional way to notify someone if you've tested positive for COVID is to contact the building administrator, your principals, that would be your principals or vice principals, or your building nurse. We then will follow up with the family or the staff member to talk more about what's going on with symptoms or positivities, where they've been in the building, and kind of work through contact tracing. And so let's just talk a little bit about the contact tracing process. Besides the notification, King County has provided us with a toolkit that we use that gives us all the questions that we need to ask families and students. We have gone down this road a few times this year, and we're learning more every time to investigate spaces, who's been where, what have you been doing while you're in the spaces, have you worked with a staff member in close contact? And so we are working closely with all of our people in our district that have tested positive. We have been asked what the COVID rate looks like for Mercer Island School District. We started school September 2nd, right? And I think the first date we had students in building was maybe that next week, so September 8th. Our first case of COVID was notified to us early November. And through contact tracing with that particular individual, they had had no close contact with any students or staff. Our second case of COVID came about 2 weeks later. That person had not been in contact at all with the first person, and also had no close contacts. Our third staff member came another 2 weeks later, and they also were in a separate building, they did actually have one close contact of a fellow staff member, and they so that staff member had to quarantine, but did not test positive for COVID. And then our three most recent cases actually came in another building with staff members, but through our contact tracing and looking at schedules and where they worked and who they'd been with, none of them had had close contact with each other. And we ultimately traced their actual COVID is suspected to have been contacted through their family members. So that is not considered a building transmission. When we have those COVID positive cases, we do reach out to people that may be impacted, even if they are not considered close contacts, just out of a courtesy to say, we're letting you know that someone in your space has tested positive for COVID. We are in the process of developing, and I think Fred can verify this, we're looking into actually having a COVID tracking dashboard now that we're getting more students and staff in building, that will be broken down by building level. So you'll see how many students or staff have tested positive for COVID, and or how many are currently in quarantine because of potential close contact. So that will be coming, and I think we're looking to have that up and going by early January potentially. And just as a friendly reminder, close contact means you have been within 6 feet of someone for longer than 15 minutes, accumulative in one day. So close contact also obviously happens in your home with your family members as well. We are encouraging people, although it's not a specific requirement, if you know someone in your family is having symptoms of COVID and they are getting a COVID test, We'd like you to stay home as well. It's not a requirement by the health department, but definitely if people have cough, fever, some of the really significant, obvious potential symptoms of COVID, we would like you to keep yourselves home until you tease that out within your families. Did I miss anything else? Nope. Oh, a question about the district. What will we do to ensure masks? I think I already went through that. We will require it, but I'll defer to someone else if you want to talk about what's happening if students refuse to wear a mask. We haven't had that yet. Everyone's been pretty compliant, and sometimes we may notice that a student or a staff member is forgetful, and we always are operating under the assumption that they have the best of intentions and just might be misinformed about what they're supposed to be doing in their space, and we're giving friendly reminders, and we really haven't had any trouble. But if someone else wants to jump in with the back end of that question, I don't know.
I think just Carla adding into that, we have we have students who test many boundaries, and to think that they're not going to test the boundaries as we bring more and more students back would not be completely. I wouldn't be honest as an educator if I wouldn't say that, because I probably would have been one of them when I was in high school. So with that, our teams will intervene like they normally do. Some for younger students, it might be a reward system. For our older students, something else. But we'll respond just like we do when students are testing boundaries in our normal times. Like you said, so far, that has not been a problem for any of our students who have been in the buildings. They've been incredibly committed, just like we are, to keeping everyone safe and healthy.
And then the question regarding if we aren't going to be adjusting 6-foot spacing, how will we address in-person learning for classes too large to fit everyone in the classroom? I think you're going to be hearing about that a lot more in further slides. What we do know about cohorting, it's a lot easier to do in elementary schools than it is to do in middle school and high school. So the cohorts for elementary schools most likely will stay pretty static. Whereas at middle school and high school, if we do have classroom changes working, then that's going to be a little harder to do. So cohort sizes may just be much larger than a class of 30. Before I end, I do want to give a shout out to my colleagues. They have been amazing. I co-lead the nurse team with Shelly Sage. She is our extraordinary nurse experience of the high school, and it's been my pleasure working with her and having her to be able to run ideas by. And the elementary nursing team has also done an amazing job jumping in. Eric Eaton at West Mercer, Rachel at Lake Ridge, Krista at Island Park, and Betsy and Emer at Northwood. There have been many of my jobs that I'm normally doing this time of year that we still do, even though kids are remote, that they've jumped in to help me or take on, because I've spent a lot of time learning and working with planning for COVID. Thanks, everybody.
And Carla, thank you. I know we're in the midst of everything of it all and nowhere near the end, but you've been a tremendous advocate and resource for our school district. So thank you for being here tonight and everything you're doing each and every day.
Thank you, Carla, and thank you to our community, because Mercer Island School District has prioritized having a nurse at each one of our sites, and that isn't the case everywhere else in the state, and it has definitely been a major asset for all of our students to have that service. We're going to talk briefly about our operations and facilities and what has our maintenance and operations team done to ready our students to return. There's been so much work behind the scenes that is now in place. So I'm going to ask our Director of Maintenance and Operations to jump in on our safety plans. Tony Kuhn.
Thanks, Donna. Good evening, everyone. As Donna did say, this will be brief. That's the way I like to keep it. As Donna mentioned, I am the Maintenance and Operations Director for the district. I want to start by saying health and safety for our students is definitely at the forefront for everyone. And I just want to kind of highlight some of the areas that the crews have been working on as we move forward. We'll continue working on. We are closely following the DOH, CDC, LNI, and EPA regulations in our cleaning process. In addition to the custodian's general daily cleaning procedures, the custodial staff is cleaning and/or disinfecting high-touch areas throughout the day. This includes door handles, handrails, water sources, countertops, and restrooms. The restrooms are being serviced twice a day, once during the school day and again as part of the regular cleaning, the nightly cleaning process. We are using a hospital grade disinfectant cleaner and a DOH endorsed cleaning process nightly in all of our buildings. Carla mentioned a little bit about distancing. Some of the extra things we've done, we've placed signage and age appropriate reminders throughout our campuses. We've installed some distancing dots around the perimeter of the 4 elementaries as an aid to keep students safely apart. I was mentioning to Ty earlier today that if they took an aerial shot of some of our campuses, it would look like we had chickenpox. We set up the classrooms to provide appropriate physical distancing. We've removed some items from the classrooms to help as kids move around to make sure that they have appropriate distance between them. Plexiglass screens have been provided for workstations and locations requiring close interactions. Ventilation, Carla mentioned this briefly. Again, we're following the recommendations from DOH. Our ventilation systems are set to maximize the amount of outside air coming in, and the recirculation has been minimized. Our systems are being fitted with the highest filtration rate filters that can be sourced and installed without negatively impacting their performance. So with that, I will hand it back to Donna. If there are follow-up questions, I would encourage you to reference the response plan, or feel free, you can send me an email to my district email account as well.
Thank you, Tony. And we've also been able to keep the temperatures of our buildings at a reasonable space. Initially, we thought that they'd be much cooler, but they really are at the recommended temperature that really makes it reasonable to be in our buildings and working, as many of our staff and some of our students are already. So moving forward to what's happened in September to December timeframe for our students. We know that we've had some students who've been able to come in, and so we're going to update you on where we are and how we've been able to bring in some of our most impacted learners. Fred.
Thank you, Donna. Since, as Carla mentioned, the second week of school, we started bringing in students by appointment. Many of these students were ones who benefit greatly from our services and our supports that we provide. We would argue that all students benefit greatly from our school district, but we also honor and recognize that we have a number of students who have an even greater need. And so we've been serving students. Just this week, we fully opened our early childhood program, which operates out of Northwood Elementary. They had been on appointments as well, and through the concerted effort of our entire team in special education and special services, we are pleased to announce that that program is fully open at this point, and students are coming in their AM and PM sessions. And this is an excellent example of another step that we're continuing to make to move forward. You're going to hear in a little while some more detailed examples from our schools, but we've been bringing pods of students in to our high school and our middle school. Again, these are our students who have really struggled the most and who seem to be not just academically necessarily struggling, but it could be socially and emotionally. And so we've been bringing in pods of students into our high school and our middle school. Our elementaries have been doing that as well. We have examples of some students who are coming in to learn in person while their classmates are still remote. Again, our focus is on removing barriers, especially for those students furthest from educational justice. And that term has been used quite a bit, certainly at the state level and regional level. And I don't think it can be minimized or set aside, that we truly have some students who are benefiting now because they are back in our schools. As you'll hear tonight, our goal is to continue that process. And then extracurriculars and athletics. We're still working on some of the extracurriculars. We know that many of our clubs and organizations are meeting online. We have teams through programs that we've offered in the past who have been able to still get together and prepare for competitions, albeit very different. But athletics are also something that we know that our students benefit from and have wanted. And so we have nearly 400 high school, middle school students participating in various ways through athletics. While it's not competition and it's not practice like we normally think about, it is opportunities for students to get together in safe and meaningful ways.
We want to talk a little bit about student voice. Students are the priority, and we recognize that we need to listen to our students. We need to hear their concerns, and some of the ways that we are doing this during the pandemic, and as we do at all times when we're listening and working with our students, I have a superintendent student advisory that has representatives from each of our sites. And this year during the pandemic, we're meeting monthly, and Dr. Rundle and I meet with them and hear their concerns and get their feedback and their input. They're very insightful. I know that our high school administrative team meets regularly with their leadership and ASB. We have school board representatives that our board is able to tap into and hear their voice at the board level, and how are our students doing, so that our board has that representative voice. We are using student surveys based around remote learning, social emotional learning, and you'll hear a little bit more about another survey we've done called the ESPERT. We'll describe that a little bit more in a future slide. But something else that's occurring at each of our sites is our principals are meeting with students via Zoom, whether it's a leadership team or a class or a grade level, and that's going to continue as well. We know that we need to hear our students and their experience and adjust and pivot from what we hear from our students, as well as the input from our staff and parents. So we appreciate it when we do send out surveys for all of you that do respond, because it really does help guide our decisions. The same by all of the input that we receive, whether it's via email, to our board, to our site administrators. It doesn't mean that one voice is heard above others, but we do consider and read all of the input that is sent to us. So let's move on a little bit to January 2021 and beyond, with where we're moving next and what we're looking at. One of the things that was definitely shared with us from the PTA Council was their concern, and ours as well, of many rumors and misunderstandings that are kind of floating around the community. So we received these from the PTA Council, and we thought, well, let's just put them out there and answer them as best we can. So rumors and misunderstandings. First one is the school board contemplating closing schools until 21-22 school year? That is false. That conversation has not been had. We are continuing to move forward in bringing more and more students in. Next one, Mercer Island Education Association does not want schools to open until 2021-22. That is also false. We work continually with our partners in our labor organizations, and we have not had or heard that conversation. Schools will not open any further until a vaccine is widely distributed. That is false. If you look at the decision tree, it does not at any time mention a vaccine. We will still have to follow protocols for some time, even potentially when a vaccine is started to be distributed, but it doesn't mean that we're not going to continue to bring more students in. Yellow learning still means all students return. You're going to hear tonight a little bit of the pivoting that we are doing as a school district as we've learned more, and as from the original time we started building our plan and are bringing back students to where we are now. The decision-making tree is going to change. That is very likely. There's been some information in the past week or so that it wasn't going to change, and then a statement from the governor's office that was a misrepresentation. I was on a state superintendent meeting yesterday with all the superintendents in the state, and our state superintendent talked very positively about a change. It certainly does come from Department of Health, but his projection was that there would be some changes to the decision tree. And the last one, petitions and letters from stakeholders influence decisions. Well, that's true and false, because we do take all of the information that we get from surveys and letters and concerns, and we have to weigh all of them in making our decisions. And of course, there are always some who are unhappy with the decision that we make because it isn't necessarily the one that they wanted us to make. But we do consider all of the information that we gain from our community and our students and our staff when we're moving forward in our decision-making process. So where have we been? Where are we now? And what does the future hold? I'm going to ask Fred to kind of walk us through the timeline and the actions and the COVID impacts in each of these time periods.
Thank you, Donna. Just want to kind of take a step back, and as we think about the road ahead, think about a little bit of where we've been, how we've gotten there, and then why we're making some changes to our decision as we're moving forward into January 2021. Obviously, in spring 2020, we were responding to the moment like so many organizations and entities, and it was really reacting. We were in the midst of the initial surge. At times we were being asked to give away all of our PPE to hospitals and other healthcare workers who needed them more than we did at the time. And then we've learned now that we need them as much as anyone to keep the community healthy. During the summer of 2020, we did a tremendous amount of reflecting and planning, and we convened our Learning Forward teams, which you'll hear more about tonight, consisting of students, staff, administrators, community members, to really start planning and preparing for what is now the current school year. During that time, we were really focused, especially in June, really May, June, and July, on two different models. One is a continuation or a rebuild of the remote model that we were on in the spring. And the second was a hybrid model. And you'll hear more about that tonight. Once we got into late July, if you recall, there was a second surge in cases following kind of that 4th of July period where the governor had relaxed some of the restrictions. And as cases were going up, it became evident, especially as the decision tree was being contemplated and rolled out, that we were not going to be opening in the state of Washington in a hybrid model or back in full capacity. At that time, we really made a concerted effort to reflect and listen carefully to our stakeholders from last spring. It was clear that stakeholders wanted something that was more consistent, learning that was more reliable, and more opportunities for students and staff to engage. And so our Learning Forward team spent all of August, and our instructional coaches were building professional development, really to get our entire organization ready to launch the very best remote learning model we could. And that's what we've been operating under since then. As we've rolled through the fall of 2020, I think our hopes were that we would be able to start moving back at an even faster rate. Unfortunately, that success that we had in August and September to start flattening the curve rebounded in October. We had that third surge, if you will, and that forced us into really starting to think about what does the future look like, given the fact that the number of cases per 100,000 was surging. We spent a tremendous amount of time, as Carla Rimmer discussed, making sure that we were focused on all three aspects of the decision-making tree. The cases per 100,000 are important, but they're not the only factor. We have to meet a number of criteria related to health and safety, as well as our ability to contact trace. And we have those in place, and we are ready to go as we're moving forward. So the winter 2020, which is right now moving forward, is really a recalibration and an adaptation to our original thinking. Our thinking is no longer that we're going to be able to sustain the education we want for our students in a fully remote model or a mostly remote model, we need to really start thinking about students returning. We put a tremendous amount of emphasis into our kindergartners and our first graders, and we're going to be putting that same emphasis into a remote and hybrid model that you're going to hear about tonight and in future presentations for our 2nd through our 12th graders. We don't know what the surge is going to look like after the winter holidays, but I do know that the commitment that we're making right now to health and safety in our schools is going to continue to propel us forward in the future. So we have teams at all 3 levels who are meeting. They're called our Learning Forward teams. They are comprised, as I said, of staff, parents, students, and administrators. We welcome community input. Even if you're not on one of those committees, you can certainly submit input through the PTAs or through your building administrators and other community members. We're meeting with we're meeting with and learning from schools across the country. You'll hear a little bit more about this, but we, through contacts and through connections, our schools have been talking to schools in Indiana, Connecticut, Colorado, California, and others, especially looking at states that have had different reopening restrictions and or guidelines, and they've been able to either open up and then unfortunately close again, and in some cases open and remain open, particularly with those hybrid models. And so I know that also next week, or perhaps even later this week, I don't recall, Principal Kelly is going to be convening a high school roundtable with other high school principals from private and public schools across the country to continue to learn and grow from people near and far, as close as Bainbridge Island and our friends in Pierce County, and as far away as you can see across the country.
So one of the priorities that we have always had in place and we have planned for is our youngest learners. That has been something that you heard our Sarah talk about from County Health, how that has been always a priority within the decision tree. And we, in the summer, built a plan that allowed us to bring back our youngest learners, starting with our kindergartners. We, of course, have had to work through many complexities of this, including, of course, the staffing, as we spoke about earlier. But we now feel we have all the pieces in place. We have, if there is need to be staff or students quarantined, we now have the agreement in place to be able to do Zoom streaming for the adults or the students for when they are in person. That was kind of one of the last puzzle pieces, but as you heard, we have all of the other health and safety mitigation strategies in place. So our plan for kindergarten students to return on January 6th with 2 days of asynchronous for teachers to train and prepare those first 2 days back after winter break. And then 2 weeks later, our first grade will also be returning with their first day on January 19th. This plan does not have any hiccups that we would anticipate having to move the date. Of course, we do have to keep in mind that the governor or Department of Health, if there was a huge surge, might close schools, but we're not hearing that. We're hearing support, continued support from our local Department of Health on this plan. We have met with them consistently on it, and they are fully backing our youngest learner plan to bring our students back. And now let's talk about the other students in our elementary program. So I'm going to turn this back to Fred and our elementary principals.
Great. I had an opportunity to talk to Principal David Hoffman from Island Park earlier today, and he had been meeting with the other elementary principals actually just this afternoon. And as Carla was saying, either he drew the short straw or the long straw, but he's the representative tonight. So Principal Hoffman.
Well, thank you, Fred, and thank you, Superintendent Kolowski, for this opportunity. My lighting at home is not great, but if you could see me, I'm smiling because on behalf of all of my elementary administrators and colleagues, we are greatly looking forward to making it possible for all of our elementary students to return to school. And we are on track to bring our kindergartners and then our first graders back to school in January in accordance with OSBI and county health recommendations to bring our youngest learners back first. We will continue to conduct all year remote learning classes for kindergarten and first grade families who have chosen that option. And then it's our intention, and we're working really hard right now to soon after bring back our 2nd through 5th graders. Our elementary learning forward team, consisting of educators, administrators, community members, has been meeting since last spring to review schedules and different instructional models. And in fact, before joining the meeting tonight, we just met to dust off and discuss different hybrid models that would facilitate the return of grades 2 through 5. Recognizing, of course, safety, health, social distancing, staffing, schedules, working with our middle and high school schedules, transportation, food service, related issues, challenges, and of course, opportunities. And at this time, and mainly due to the social distancing requirement, we are working on a hybrid plan consisting of A/B in-school attendance days, where half of a class will be in building while the other half is receiving the same in real-time lesson at home. And we're also building into schedules times when the entire class will be able to meet via Zoom streaming to have that important all-class community building time. We are partnering with our Learning Forward team to iron out the details, and we will communicate the final plan to all of you as soon as it is finalized. And we're very excited that we will soon see our students returning to school.
Thank you, David. And just a reminder that in the decision tree, it does contemplate, especially as we are not down into the lower levels, but that we can continue to add in and layer in more in-person learning as we demonstrate that we're able to control transmission and do so safely. And so following our K and 1 entry, then we'll be looking for those timelines for that 2nd through 5th grade. So now let's turn one quick update. There were some questions from families around our year-long Red Remote option. Currently, we have 2 kindergarten classrooms, and we will also have 3 first grade classrooms that will be Red Remote for the year. We're undecided at this point as moving forward in terms of adding more for 2nd through 5th grade. That has evolved as we've been talking about bringing back kindergarten and first grade. But there was a question about, will we be planning for remote options similar to this year, next year? And right now, we don't have any active plans for that. Our main success and really where we've excelled the most as a school district is those opportunities to bring students back in community. So with that, I'd like to invite Mary Jo Budges and Aaron Miller from the middle school to kick off our 612 conversation and give us a similar update, and then we'll go to Walter Kelly from the high school.
Thank you, Fred. I want to take the start on this. I think your slide earlier about the progression, sort of that past, present, future slide, really resonates with what's happened at IMS and what continues to happen. So our Learning Forward team, amazingly enough, has been meeting for 9 months. We started off really talking about how to make that emergency teaching happen, move forward into talking about what a hybrid looked like over the summer, and then realizing that wasn't going to come to fruition right when we started school. We really focused on making the fall the best start it could be with that consistency and predictability. But just recently, as we've started to get more kids in, we started to talk a lot more about what our next steps might be. And one thing we are hoping to launch fairly quickly after winter break is we have about a dozen teachers, a little more than a dozen IMS teachers that are interested in trying what we're calling an in-person pilot program. And so that's bringing small groups of kids in to try a variety of things in our school. Maybe that's having some kids come after school, before school, during office hours in the afternoon, during class time, where there might be some kids in the classroom while the other kids are streaming or zooming in. So we want to try some things at IMS. So when we do get to the point that we can have hybrid. We've tried some things to see what's worked, what hasn't worked, what we need to do to refine to make it better. So we're hoping to get the okay to start on that pretty quick after winter break. And then we're really going to continue to look forward to what a hybrid might look like. As it mentions on the slide, I think there are some questions and some discussion about an A-B model. In terms of group A being on campus and B being at home and switching based on days. We also will have discussions and have some preliminary discussions about whether we should bring in certain groups first. Should we bring in a grade level rather than an A, B, all grades? So those are discussions we're going to have, and we're really going to learn from the kindergarten and first grade experience and really see how we can make our experience better for our kids when they do come back, which is hopefully soon. Mary Jo, do you want to add anything or anything that I missed?
You know, I don't really have a lot of more content to add. I just want to say how honored we are to work with such an amazing staff and parent community at IMS, and how fabulous it has been to see kids walking through our doors and interacting with them and supporting them and working with them. And we can't wait to have more kids back in our building and more staff back in our building. But our whole staff has been giving it their all. Remote has been a challenge. People are relearning all kinds of things. And I just want to thank our Islander community and our IMS staff for everything they're doing right now, everything they're doing in planning for what's to come, and for their grace and their dedication and their hard work to the kids on this island. And I'm just really proud to be a part of this ongoing work. So thank you to everybody.
Great, thank you, IMS. Want to bring in Walter Kelly, our principal at Merceron High School, to talk about present action taking place at the high school, and then your plans for moving forward with hybrid.
Fred, thank you so much. I appreciate it. And thank you all for attending and being present this evening. First, I want to share with you what is happening currently during remote learning, or red learning, as we've discussed earlier. Then I'd like to talk about how we're planning for a hybrid model of learning when that moment comes, fingers crossed. I'd like to talk about the process of how we're going to make those decisions of that schedule, commit to making sure that we will be ready to go as soon as the light goes on, the switch is turned, and we can bring some students back. And then last, talk about a couple of considerations on onboarding for that moment and making sure that we're prepared for it. So back to the start, during red learning or remote learning, I'm going to use those terms interchangeably. We have a care team consisting of both certificated and classified staff that are dedicated to looking at attendance, teacher concerns, grades, any SEL concerns, and reaching out and reconnecting with students during this distance time. And that work has been going on since the beginning of school. Secondly, we have a few pods of students that total just under 20 students that we have brought back because they're the furthest from educational justice and are the most at risk. These students are coming in and simply sitting in 5 to a room with a staff member supporting their learning and making sure that barriers can be removed immediately. I want to applaud the students who've done this. This is not an exciting time to be in high school. So they're there doing the work and sticking with it. And we'll appreciate especially Marcus Tubbs and Kristen Brittenall for their work with these students. We also have over 300 students involved in athletics and podded workouts. They're doing daily attestations and are staying involved in some of the sports and activities that they love. We have just completed a student and teacher survey at the end of the first quarter to give us insight on what's working and not working with remote learning. We've also done a grade analysis at the end of the first quarter, and we're in the process of doing an SEL screener for student wellness for 9th graders. We're in the process, we're almost completed with that, and that's individualized versus holistic, such as the surveys are. We also have been addressing and working with parent and teacher referrals for support for students. So what we're trying to do is make sure that we're keeping our teachers and students connected with positive relationships and addressing the challenges for students who are really struggling during this time. but we're really hopeful. We're hopeful for that next step, and we're crossing our fingers that it comes sooner rather than later. We are planning for a model which will involve hybrid instruction. I think the best guess or summation would be we're looking at a model that would be, when we bring students back, that would reduce the number of students in the building at any one time so that we can have greater social distance and safety, and would probably be something like an A-B rotation, pretty similar to what we would see in a typical school schedule, but with some adjustments because of that A-B rotation. So while we aren't at that point, I'm going to walk you through the process we're going to use to get that ironed out. But that's most likely the thing that will work, that will not decrease learning time in as much as it would be if we just had half the students in, half the students doing asynchronous learning. It would be all students synchronous, half in the building, half at home at any one given time, and streaming in. Now, the process we're going to use is, I appreciate Fred sharing this. We've got a group of high-performing school principals, some private, independent, some public, from across the country. We're convening tomorrow afternoon. We're going to be sharing each one of the schedules, the political and legal limitations we each face, some of the challenges we each face, but also we're going to be viewing a variety of models all the way from full in-person to totally remote. And we're going to be looking at each one of those, determining data points we want to follow with those, with learning, mental health, and also with safety with COVID. And we're going to be using that information to go to our Learn Forward team this coming week. This coming week's Learn Forward team will review the RED or remote learning schedule, make recommendations for adjustments in that during our time in remote learning. We will also start our brainstorming based on the feedback from other principals and ideas that come from our community during next week's meeting. We will then reconvene in early January, and we will make a recommendation as a Learning Forward team in January on how we will do the next step of learning when we get there. So we will be ready for that moment when it comes. We will then publish that information, and then we need to work on the meantime. What our goals and our work is right now, are right now. One, we want to increase the number of students we're bringing into the building for in-person support for those that are struggling the most. With our current model, we are moving that number from about 20 up to about 70 or 75 in the next few weeks. Then we will be looking at other ways to use our certificated staff to provide in-person support when that is appropriate and necessary in the next few weeks. The timelines that we are looking at are, first, we're looking at January the 4th. When we come back, we want to make sure that our RED learning schedule is modified in the way that best serves our students. The end of the semester is another point that we're looking at carefully at the end of January on the 26th. Then looking at that time in February coming back from winter break, a midpoint in March, and that time coming back from spring break in April, of those times that we're looking to see where the data is, and obviously following the lead of the district, and when do we make changes when possible. We want to consider, whenever we bring students back, that we also provide the right technology, the right training, and the right for our teachers, but also onboarding our students. We have ninth graders who've never been to school on our campus. And we want to make sure that we take time whenever we do come back to prepare for that moment, to take a few days to get them ready and to work on the other students coming back on campus and welcoming them back to Mercer Island High School. Fred, I thank you. I think that covers most of the points we discussed.
It does. Thank you very much, Principal Kelly. And I think I want to summarize all of, especially the 2 through 5 and the 6 through 12 conversation with this. And that is that Superintendent Klosky and I were talking as early as today, and it's about being hybrid ready. We know that we can't do it tomorrow, and we won't be able to do hybrid for those students on January 4th. But what we want to do is be ready so that when that opportunity comes, we are not waiting weeks, but rather we are implementing in days to be ready. And so that's what our school teams, as you just heard tonight, will be working on. We are excited that our kindergartners are coming back and our first graders, but we're not going to be fully satisfied until we have K through 12 and those preschoolers and our adult transition program really back in action. So with that, I wanted to just invite Dr. Sue-Ann Booby in for a quick update on special services.
Good evening. Just a reminder that all of our students are general ed students first, or general education students first. And so our students do follow the general education schedule. So as we look at our at-risk students and bringing more back, we are working with the building teams to ensure that students have a continuity of services. So we have been bringing back, we started out on, I think, September 8th, is that what it is? The third day of school, bringing in students, and we started out with about 40 students in person. We're close to 100 students in person right now. And as IEP teams meet, they are determining if a student is at risk and they need different support. We're always trying what we can do first remotely. And then if we need to, then there's a consideration to bring a student in to on-site learning. So we have a rolling start, but we are working to bring in more students that are at risk at second semester in the secondary. And part of that reason is they're bigger buildings, and we want to make sure that our transportation department and our teachers aren't having to create new schedules every time they want to bring a new student in. So we're going to be looking at our data over the system, and then working together with the buildings to bring in the new cohorts so that we're doing it safely and that we're honoring our teachers' times so they're not having to recreate schedules and constantly then recreate like the ESA schedule for related service and physical therapy, that we're able to create continuity across our system.
Thank you very much, Sue-Ann, for that update there. A couple of just quick questions that have emerged for our district-based questions. And just a quick one to you, Superintendent Klosky, of would the district characterize remote learning as a success?
We certainly know that our goal was to improve on the emergency mode we were in the spring. And we hear from our parents of how much more robust and how much better the learning experience is for students in remote. So yes, we do feel it is a success, but can we do better? Absolutely. And we also know that after this very extended time, which none of us really anticipated to be in remote this long, we do need to have our students experiencing some in-person. And that's why we're trying to pivot and trying to bring more students in.
And I know we've received some questions, and I think the ones that came in from Christy, certainly just some questions around why are we using the decision tree when others appear not to, or the decision tree seems so different than other parts. I think you touched on it earlier. Any follow-up?
Yeah, I think it's really important that certainly private schools are expected to follow what's within the decision tree, and frankly, they can. They are much smaller. There are many private schools are able to have much smaller classes. So having their students in their classes, they can say, we are socially distanced, we have that 6-foot perimeter. And if they were in person, the governor and OSPI has not asked them to pull back. The really big challenge is the secondary students, and having secondary students that are difficult to cohort, that are in a comprehensive program where they're moving about campus in large numbers is what becomes really, really critical here. The last, go ahead.
Lastly, in case there's any mistake out there, we know we've received lots of questions here. We're really recalibrating. Donna, where do we stand on Zooming and streaming?
Yeah, I think this has really evolved over time as well. When we first went into this crisis mode and remote learning, we hardly knew anything about Zoom. And now we've gotten really proficient at it. It keeps updating. Our tech team has been phenomenal in keeping everybody trained at it. Our staff is much better at working through Zoom. And frankly, our students are as well. If you've watched some of our very youngest students in Zoom, they know exactly how it works and what to do. So being able to use Zoom for a streaming when half the kids are at home is much more viable than it was when we first started in this realm. It also is a great tool for if students have to be isolated or in quarantine, and the same goes for staff as well. So certainly our thinking has evolved around this. Originally, we didn't know how the tool would work, and now we do, and we're pretty proficient at it. So moving forward, we had a lot of questions around bargaining and our partnership with our MIEA. And so I am going to ask our Executive Director of Human Resources and our lead bargainer, Erin Battersby, to go through some of the questions around that were posed around collective bargaining. Erin?
Thank you. Yeah, so there have been really a lot of question about what is collective bargaining, and frankly, a lot of speculation of how it has looked since the pandemic started. And so since most people don't spend loads of time at the table as I do, we thought it would be appropriate to sort of give you a high level of what we have to do. So the district and MIE have to negotiate matters relating to wages, hours of employment, and working conditions. Those are mandatory subjects of bargaining, which means the district has to give the MIA, as a representative of both our classified and certificated teachers, notice of a working condition or a change, and then we have to discuss with them and negotiate in good faith any, pardon me, I had a phone ringing, any impacts on the working conditions. With the COVID situation, we started out, if you go back early on in the presentation, we were really in reaction mode. So we were changing quickly, and it really was a partnership trying to figure out how moving to a semi-remote model was impacting our teachers and how we could really serve our students best. I think as we move forward, we continue bargaining and working together to try to build a better system and a better remote model for our students. But all of those things took bargaining. The topics were health and safety. What are the schedules? What equipment do they need? What do they need training on? All of those things have to be discussed because those are impacts on working conditions. Another question we've gotten is, well, it may be the law, but how come it takes so long? And it takes a long time because these are complicated questions and we're learning sort of as we go. And we need the cooperation and support of our union partners and of our teachers and classified staff, because staff are essential to our operations. We cannot teach our children without our staff. So we need them to feel comfortable in our schools and understand the health and safety protocols and feel like they have all of their bases covered and the tools they need to effectively serve our students. So at this point in time, we've worked together and we've addressed the various phases of opening, and all that's really left are extracurriculars, the 2 through 5 hybrids, the 6 through 8 and 9 through 12 hybrids. We have negotiated largely the health and safety protocols that we need to address, as well as sports, kindergarten, first return of our highest needs students, and those further from educational justice, streaming to kids who are out ill. So we have all of those strategies and negotiations done. So this is our next big lift to bring students back. So that brings us to the next slide, which is sort of, what does that look like? I gave you an overview, which is that we create memorandums of understanding. Those are the result of bargaining. Those are the agreements that sort of outline how we are going to play. What are the rules to teaching and serving our students? And the topics that I addressed, which was first we had the COVID reopener, which was how we were going to stream to students. And then, as I said, serving the highest need students, Zooming and streaming when students are ill, the kindergarten and first grade protocols were the following MOUs. And so those are available on the district website for all members of the public and staff to look at. And that really outlines what we will be doing as a district to ensure that our staff and students are safe, and to ensure that there's a reasonable expectation of what will happen during a school day. Some of the questions that we have that were a little bit more pointed, I wanted to address here because there's confusion, I think, in the community. The MIA has never refused to return to the building absent a vaccine. I think there's a rumor that that is true. That is not what I've heard at the table. The MIA does want our students back in schools, and they want them back in schools as soon as they can reasonably be there, and be there in a safe manner. So that was why so much time was spent on negotiating the health and safety protocols. And I can't thank enough the efforts of our nursing team, including Carla Rimmer, who you heard from earlier, and the members of the bargaining team on both sides in terms of figuring out creative ways to make sure that we are protecting and doing the best we can to mitigate the risks of COVID. The other concern is that some MIA members are refusing to come in the building at all. That's not true. We do have MIA members in the buildings, and they're already working directly with students. This was true for our district, unlike many of our neighboring districts, the first week of school. So I'm very proud of that. And I think it's something that the MIA is also proud of, because at the core, we want to serve our neediest students. The district is actively negotiating the next steps towards returning our 2 through 12 students. So going back to that earlier slide, there's no plan, there's no position of either the MIA or the school board or the district that we're not returning our 2nd through 12 students until fall 2021. We are trying to get them back as soon as possible, and we want to be hybrid ready. So we're actively negotiating those hybrid models. In fact, we'll be meeting tomorrow. Finally, we will be using the following things to determine sort of when we will bring more students back to in-person learning. As Donna mentioned earlier, we've been relying on the decision tree to guide us with respect to health and safety. And then we're also going to look at our demonstrated success of bringing back the groups we've already brought back into the building. As Carla mentioned, we've been very successful of serving our students in person and not having exposure and not having spread of the COVID virus. We have good and robust safety mitigation strategies. So we think and believe that we can do this safely for a larger group of students, but we will continue to monitor that as we in fact have more kids on campus.
Thank you, Erin. And I want to reiterate, I think as many in the health community will reiterate across the state and across the nation, we're really learning that schools are one of the safest places to be, and we are ready to have our staff and our students in that safe environment. There were some questions around enrollment and finances, so we're going to talk really quickly. Thank you for sticking with us. We know we're almost at 90 minutes, but we did want to answer some of the questions around 2021 and beyond when it comes to the district finances. So I would like to introduce our Executive Director of Finance and Operations, Ty Bergstrom, who will go through just one slide about some of the ramifications and the impacts that COVID has had on our finances. Ty.
So our state funding is directly tied to our student enrollment. We get a certain allocation per student, and as enrollment goes up, so does our funding. As enrollment goes down, so does our funding. This year we are 214 students below what we had projected, which is about 5%, which tracks with every other district within the state pretty closely. They're all about 5% down. What that means for Mercer Island is we're looking about $2.6 million shortfall for state funding. There's further impacts as we move further out in time. Our levy is also, our local levy that the community's voted on is determined by enrollment as well. And that lags a year. So the 2021 levy is based off of the 1920 enrollment count. So as we move forward a year, the decreased enrollment will also affect our levy, which increases our ability to be more flexible and agile. So this is a long-term complication. And as we move forward into 21-22 school year, we'll be looking at enrollment and how does that play out. We had a discussion with the board a few weeks ago, looking at how we should be projecting enrollments and budget implications. We'll be having another study session with the board in January after the New Year's break or the holiday break, discussing what we're going to be doing with enrollment projections and potential budget reductions for next year. There's no doubt about it. We will have to make some adjustments to the budget. But what does that look like? We're still making some discussions.
And we do know that what happens with our enrollment for 21-22 will be what will impact our financial status as well. We are way less kindergartners than anticipated. That is a trend, frankly, across the nation, not just the state. So knowing what those kindergarten numbers are going to look like for next fall, as well as how does our first grade transition, is a lot of unknowns that are really going to help have us make some different decisions than we've had to make previously. Well, it is 6:30. We have spent 90 minutes hopefully answering a lot of your questions. We know that you probably have more, and so some future topics that we know we're going to have these webinars on, and it might not be an entire crew and leadership team, but those who are going to be able to speak to important topics like fall 2021 kindergarten registration. We know that our Mercer Island Preschool Association has lots of questions about that. And so we'll be reaching out with some webinars for that will feature our elementary team as we guide our families through that. We anticipate that'll probably be in early February. We'll also do updates on the hybrid learning, and we'll probably break those out into smaller webinars so they'll be specific to each of the segments so families can get the specific information that applies to their level. Some of you might have to go to more than one webinar, but we want to make sure that we're really giving the solid information to folks as they need them. And then, of course, we want to keep everyone informed as we move forward into fall 2021-22 school year. We are hopeful and optimistic with the vaccine information that is moving forward, and know that it is going to make a difference for us. Our schools are going to be open in 2021-22. Will we still have to have some mitigation strategies in place? Are some of the pieces that we're going to have to work through with OSPI and Department of Health as the year moves forward. But we fully anticipate that we will have students in our schools in the second part of this school year, and definitely in 21-22. Thank you very much to this amazing team that you see in front of you. I'm very proud to work beside them and with them. They are, if they look a little tired, I know they are, because they've been on this now for 9 months. Thank you also to our PTA council and all of our individual PTA sites. They have been an amazing support and communication for us. They are our partners in this, and we are so thankful for their support and their help in communicating out and getting the information when we need it, and getting the information back to you. So I encourage you to reach out to them if you have further questions. If you have questions specific for your child, please reach out to your school's site administrative team. They will make sure that they support you in getting the answers. If they don't have it, they'll find someone who does help in supporting your child. So thank you again. This will be posted on our website. So if your friends ask, send them there to get the information. Thank you all, and good night.